So good evening, everyone. You're very welcome to the Royal College of Physicians of Ireland Diploma in Paediatrics. We're delighted to have so many on tonight, considering it's such a beautiful evening. So thank you for attending. So the running order is, first up is Diarmuid, our Head of Academic Affairs in iheed, to give you an overview of the programme. Off you go, Diarmuid.
Yes, thanks so much, Rebecca. Great to see everyone here. So I'm going to share screen, and what we're going to do is give you an overview of kind of the structure of the program, the format, all of the supports, the regulations, and really just a good in-depth overview of it. So hopefully you can see my screen there now. Bear with me 1 second, just get Zoom back as well. And here we go. So one of the things you'll notice about this program is alongside the College of Physicians, you're going to see iheed used interchangeably. And first question, who are we? We're an Irish company. We were founded by a family doctor from Tipperary, and we have been delivering for the past 7 years. We've been delivering postgraduate medical education to audiences all across the world. We've done a lot of work in family medicine, capacity building across the Middle East and South Asia, and we have qualifications in public health, medical education, diabetes, and paediatrics with the likes of the University of Warwick, the College of Physicians. We've had a really nice cancer care program with UCC. So all we do is online postgraduate medical education, and we design, develop and deliver the programs to global audiences. We've had over 400,000 course completions to date across all of our programs. That's everything from short CME up to residency programs. And this program has had over 1,000 students on it since March 2020. So it's an incredibly popular program. We're continually surprised by its popularity, and delighted to be working with the College of Physicians on it. The College of Physicians really need very little introduction. Founded in 1654, they are in charge of all of the postgraduate specialist training apart from family medicine in Ireland. Faculty of Paediatrics was established in 1982, and they co-developed and accredit this program. So what you get at the end of it is a College of Physicians qualification. But before I launch into the actual structure of the program, we're joined tonight by Dr. Hannah, who is one of our current participants on the program. So Hannah, are you able to unmute there, or do we need to make you a
no? Hannah is a co-host already, so she should be able to unmute. Hannah.
Hi, how are you?
So look, thanks a million for joining us this evening. It's always really useful to hear from kind of the horse's mouth, as opposed to myself or Charlie or any of the tutors, about what a program is like. And you are now about midway through the third block on the program. Yeah,
so I suppose we're good. Geez, we're a good 2/3 of the way through, which I can't believe the time has flown by. It's I have to say now, it's been a brilliant course. I came at it from the point of view of being a GP and not seeing a huge amount in terms of paediatrics during the past year of COVID. It practically went down to nothing. So kind of took it as that opportunity to kind of freshen up on my skills in peds, having had very little in the way of formal peds training. Would have done about 4 months in an A&E during my GP years. So it's definitely fine-tuned those skills and made me come at pediatrics consultations in a different way, thinking a little bit more about it, being a little bit more inquisitive when faced with pediatric presentations, and I think enjoying it a little bit more as well. Certainly things that, you kind of recoil in horror at, like developmental peds as well. You're just getting that little bit more confident about opening that can of worms and commenting on how well children are developing, So it's been great, and a nice I suppose, bookmark in your week of learning. And I found, actually, funny enough, and it happens every single week without fail, whatever topic we're on, I get faced with a case in work. So it's really kind of cement those facts in, if you will.
So, yeah, there's bound to be a psychological principle of that. If you're talking about something, you're going to see it.
This is it, exactly.
How have you found so you're a busy clinician, you're juggling, I presume, family, work, study. How have you found the kind of the time commitment to the program? Is it manageable?
It is, yeah, absolutely. So, I mean, I do most of my kind of study on a Sunday when I get the chance, if you will. If I don't get it done on a Sunday, I'm kind of in panic mode then, because once the general practice week begins, it's full on. But I have a Wednesday off to do admin work, and so I kind of use that time to get those couple of hours in. And it really is a case of a couple of hours. I'm an avid note taker, so when I'm looking at the coursework, I'm constantly writing something down. But it's reinforced then with the tutorials, which are brilliant. They're absolutely brilliant. And then through your own learning during work. So yeah, no, the time management is fine. I've had a few people ask me about the time commitment to it who are, coming off maternity leaves and things like that. And it's very, very doable.
Yeah, I mean, we've designed it so that, it from the outset, it's designed as part-time, online, and everybody on it is a full-time clinician. So it's, and in fairness, we're finding that with people that they are managing to get through it, and they're particularly, the attendance rates at the tutorials are really high. Actually, talk to me. Have you gotten to know your group well?
No.
Okay.
The whole remote thing is difficult in that sense. If I've gotten to know anybody, it's the tutor, Michael Barrett, who's been amazing. Funny enough, when I was in our out of hours service on Saturday doing 4 hours, I had a registrar on with me who was in my group, which I found out. So had a bit of banter and chat about it, but that's the first kind of contact I've had with anybody from the group. It's supposed to be didactic. I'd say it's quiet at the best of times, but you kind of have the chats with Michael before and after the tutorial and ask questions and things. But it's there's a lot of content to cover in the tutorials, so it's everybody's kind of honed in on that.
And I think you're right. I think, the beauty of the program is you get to do it in 6 or 7 months. The downside of the program is you get to do it in 6 or 7 months. It's quite a full curriculum. And how have you found the assessment? That's always something that, people are apprehensive about as they're thinking about a program.
The assessments have been fine. So this was kind of my first time being proctored, as it were, which was a very strange experience. But once you've done it once, it got easier the second time, with the setup and everything. The exams are fine. Like, they're very much case-based and relevant, So if you're a lousy test taker like I am when it comes to MCQs and things, you can find yourself questioning your choice of answers a lot, but at the end of the day, there is a right answer somewhere there. It's the free text is an interesting thing that I'm still trying to grapple with. But it all comes out fine in the end. They're nice assessments.
I think we have designed the assessments to hopefully be fair. There are challenging questions in there. There are more straightforward questions, but they should all be case-based. The cases should feel relevant. And as you say, the multiple choice style is, there is a superior answer in there. The free text questions, I think, that's something that actually the college are really keen on, that, pediatrics in any area of medicine, there are numerous ways you could approach something. And, sometimes having just a multiple choice isn't the best way of doing it. And you need to actually allow someone the scope to say, well, I would focus on this because of this. That, you know, there could be 10 valid alternative answers.
Absolutely. I think that's when I came out of the first block, that's how I felt, that there could have been so many answers, and I was completely perplexed by the free text style, but then did absolutely fine at the end of it, which was great. The video assessments now, I have to say, they're mortifying, but I totally support video assessments. I think they're such a good way of learning. During our GP training, we had to do them fairly regularly, and it's fascinating to watch people back.
And I was going to say, for us, the video assessment, and we'll explain this in more detail in a few minutes, but effectively we're looking at communication skills particularly, and so you record a video of yourself interacting with an actor, and you upload that. By the time it hits us, actually the benefit of the learning is done, because you have to think about it, you have to do it, you're going to have to watch it back, and then, you know, the fact that it gets uploaded and corrected is almost irrelevant. You know,
yeah, absolutely. The second block was hilarious to do, because you had to pretend that you were talking to a 9-year-old boy or girl.
Yeah.
They were talking back at you, and so when nobody's talking back at you, it is so perplexing. And I think I tried to record my video about 27 times. That's no joke. And at 10 o'clock at night, sat there sweating, trying to actually talk for 7 minutes after 27 attempts. But yeah, no, it was a very valuable learning tool, is the video assessments. And I thought they were great. You'll get a good laugh out of my videos now.
And Charlie, do you want to come in there? Sorry.
Yes, just to say that we actually decided at our last meeting that we should have an actor in, and that you should actually be talking to a real human being in the scenarios. I think we've learned that. So for the next assessment, we're going to bring in at the end of block 2 and 3, we're going to bring a surrogate patient in, or encourage you to have a surrogate patient in to listen to you.
Yeah, that makes it more difficult though.
I don't think it will. I think it might make people maybe a little bit more at their ease, actually, you know, if talking to somebody, because it's quite difficult to talk to a camera. And I've looked at so many videos and seen them do it in so many different ways, and you know, it's quite difficult just to focus at the camera all the time. And you know, so I think certainly we're going to give the actor a go and see how it gets on. So I hope that meets with your approval.
And Hannah, I'm conscious you have your tutorial in 10 minutes. If I could kind of finish up by asking, you know, if you were somebody considering coming onto the program now with the benefit of hindsight that you have, what guidance would you give someone around, you know, kind of structuring study, or you know, as you said, kind of I think you do it in blocks. How would you approach it if you were someone starting new?
To be honest, it was fairly straightforward. You just need to be disciplined about slotting off a period of time to get it done. I remember doing a couple of tutorials, kind of the eve of a tutorial, if you will, and that was kind of good doing it the day before, because it was fresh and you just rolled straight into reinforcing that information. Yeah, as soon as the block opens up for the coming week, just cracking into it, and then you've a fresh head on you. It's not a huge amount of work. It's as big as you want to make it, to be honest, because there's all the supplementary reading that you can delve into if you're interested in certain topics in particular. So, for example, this final module that we're doing, I'm quite interested in the allergy component of it. So there'll be a lot more reading around that, just to kind of for my own knowledge. So it's as much or as little as you want to do. But what I would say is, if you are in practice or in peds as a day job, you know, just trying to reinforce that somehow in your daily practice, and teasing it out a little bit more and having a go at it, I think is really important. Anyone can pick up the course material and read it from start to finish, but actually trying to put that into practice is another thing. And that's
and I think you've hit the nail on the head. Application is all what it's about, and you know, that's the common thread throughout the kind of the way we present cases on the program and the way that we ask the assessment questions is all about, you know, it's not the knowledge, it's can you put this into practice? Can you make good clinical decisions when you're presented with a scenario?
Yeah, absolutely. But on the whole, it's been brilliant, and you know, like hats off to our tutors. They're the ones that have made a big difference and made us think about things and question things and get involved in the discussion about things. So yeah,
couldn't agree more. They're absolutely fantastic. Well, Hannah, look, thank you so much for your time. Conscious you've got your tutorial. I'll crack back into this. So listen, thank you for joining us. It's been brilliant.
Thank you so much, Hannah.
Cheers. Okay, I will share screen again and
thank you very much, Hannah.
Jump back into this. So hopefully that's given you kind of a bit of a perspective of what it's like to be a learner in the program. We'll go through all of this in a kind of more structured way now to give you kind of an insight as to what it's like. But I suppose to start again with where this program came from. If you want to be a consultant pediatrician like Charlie is, you know, that will involve 8 years plus, depending on where you are, of, you know, specialist training and exams. What we looked at was, you know, and much like Hannah said, you know, she got 4 months experience in her GP training scheme on pediatrics. There are a whole bunch of other doctors that have done, you know, specialisms in emergency medicine that again would like more depth in pediatrics. So we developed a 6-month qualification, Diploma in Paediatrics, and it's aimed at people that are working in primary care. You know, pediatrics are one of their main constituents. People at the earliest stages of specialist pediatric training. So if you're in or going into basic specialist training, this program gives you a really, really solid grounding in kind of the fundamentals of lots of areas of pediatrics. The other piece, so about, if I was to put it into percentages, about 60 to 70% of the population are probably in primary care that are on this program. About another 10 to 15% are at the start of specialist training, and then another 10 to 15% are just other classes of doctors that they just want either a refresher or more depth in pediatrics. So that tends to be, you know, we've anesthetists, we've emergency medicine, we have a Swedish pediatrician who wants to learn English, but there, you know, there's a really good mix on the program. But I think the fundamentals of it is to give you a really good overview of pediatrics and quite a lot of depth in kind of basic areas of patient management. The qualification that you get is a Diploma in Paediatrics from the College of Physicians. One of the questions that we're asked quite frequently is, what's the difference between this qualification and a Diploma in Child Health? And both will cover off large swathes of pediatrics. Both will do it to a degree of kind of knowledge and decision making. I think the main difference is that lots of the other qualifications are structured as a series of exams where you jump over the hurdle of passing the exam. Of course, we have assessment in this, but we've set this up primarily as an education program that, you know, there is a structured journey through the education program. You're in a small group and it's really, really supported as you go through. So it's not just, here's a curriculum and you're studying for an exam. It's the entire education experience, I think, is different with this. RCPI, the qualifications recognized worldwide. RCPI give 44-hour CME. Depending on where you are in the world, you can get anywhere from 36 to 96 hours from different health regulators around the world. We stress time and time again, you know, there's huge career benefit to this, but it obviously doesn't confer specialist status. It doesn't make you a pediatrician or a consultant after doing it. That said, I mean, Charlie, when you've been a consultant pediatrician for many years, when you see people that have a Diploma in Paediatrics or Diploma in Child Health on their CV, what does that, you know, what does that say to you about their motivation or I suppose commitment?
Well, I think it says that they're motivated to actually do the Diploma of Child Health and to get the knowledge to sit the exam. And even when I did it early on, and I mean, I must have done it in the early 1980s, the Diploma of Child Health in Dublin, and it did have a lot of status, especially for general practice, if you wanted to go into general practice. I think paediatrics is such a large part of general practice that it is a very relevant qualification for practice. And the beauty about this course is that we have been able to, build the level of knowledge, and we've found that people working in other specialities, especially emergency medicine, are very active participants in the course, and trying to learn background in pediatrics and improve their pediatric knowledge as well. And it's really it's not ourselves that are promoting it as a first stage for specialist qualifications. It is the College of Physicians themselves that are promoting it for specialist qualification, first step in specialist qualification. But I do emphasize it is very much the first step in specialist qualification, and we don't go into rare diseases topics in detail. The emphasis is really saying to the guys, saying, well, child presents with these symptoms, these are the symptoms you've got to look out for. This child needs further investigation and should be referred to a specialist.
I think that's absolutely right, Charlie. And I mean, when you can see there on the top points, what we've tried to do with the program design is look at, what are red flags, what will present as an acute presentation. Similarly, what's bread and butter stuff that you just need to know? What are going to be the common things you'll see every week? Areas around screening, disability, development, growth, assessment milestones, all areas like that. And I think the multidisciplinary teams, the different professions within medicine that are on the program, the emergency room doctors, the R1 or R2 GP and pediatrics trainees, the qualified general practitioners and family doctors, it leads to a really good interaction. It leads to a really, really good level of kind of discussion and debate. Hannah spoke about, the tutor, the fact of how good the tutor-led aspects of the program is. It's probably the bit that is ranked highest when we ask for feedback, is the quality of the faculty on the program. In terms of how it's structured, so there's 22 weeks of learning content, and the program, it takes a couple of sensible breaks for Christmas for the next intake, when we start in August, but it's structured. There's 22 weeks, and it's structured into a block of 6 weeks, a block of 8 weeks, and a block of 8 weeks. So as we were saying with Hannah, it's fantastic that you can do this in 6 months, but it's a busy 6 months, and it will absolutely fly. So Charlie, do you want to talk through some of the, not line by line what we have here, but do you want to chat through just some of the areas that we're covering off and why they're important?
Yeah, well, I think it's all important, and I mean, the difficulty I have in preparing my tutorials is what to leave out, because every week we just try to cram an awful lot of material in. And we have actually, since the course started in March 2020, just at the onset of the COVID epidemic, which hampered us a wee bit in trying to maintain relationships and getting people together on the course, but we just had to make the best of it. But the difficulty is knowing what to leave out, and this is why we say that the learning is very much in conjunction with the dashboard, and the dashboard is absolutely excellent, especially the case histories in the dashboard. But we start with just an induction week, and then just history taking and general examination, and that's just really going through the basics, and then giving you some hints about to recognize the critically ill child, and to look at presentations of childhood cancer, red flags of how children with cancer will present, and Then we go on to respiratory problems, which are very common in general practice, and wheeze and asthma, and then upper respiratory tract problems, and then skin conditions. We go through that. We use, or certainly I use in my tutorials, DermNet New Zealand as a big teaching aid for you, because it's a free website and an absolutely fantastic reference point for skin conditions. I mean, I do recognize that, you know, you just can't keep all knowledge at your fingertips, and very much now in medicine, the art of medicine is, you know, if you don't know the answer to something, it's knowing where to look it up. And that is one emphasis that we do have in a lot of subjects. And then we go through developmental assessment and cerebral palsy. And really, cerebral palsy, from the point of view, not that you'd be a specialist looking after a child with cerebral palsy, but you know, how you as family physicians and how you as emergency doctors can incorporate, you know, the care of children with cerebral palsy and the things that may be relevant to you. Now, for any people who are specialists in this, I do think your specialist participation is very good. And I think what you will learn is maybe some of the dilemmas that GPs have in general practice in referring children, and some of the dilemmas that the emergency doctors have. Yeah. Block 2 starts out with immunizations and vaccines, and that is very much relevant to general practice, childhood infections. And, you know, to try and cover infections in 6 weeks, you know, never mind 1 week, is just pretty well impossible. But we do give you a guide to it. Then we deal with nocturnal enuresis and urinary tract problems. We do have a specific week on child protection and non-accidental injury, which is extremely important. But you must remember that the theme of child protection, non-accidental injury, and fabricated illness in childhood runs right through all 22 weeks of it, you know, and it is such an important facet of training that, you know, that hopefully we'll be able to give you sort of signs, and based on the various tutors' experience, of when maybe things are just not quite right and that you need to just dig a wee bit deeper. We spend a week on normal growth, and then feeding issues, and then head shape and size, and then we do a sort of quasi child psychiatry week with sleep, autistic spectrum disorder, and ADHD. So that is an interesting one. And then we go on to block 3, and certainly the students are telling me that block 3 they find really the most interesting and the most challenging. And
we go out with a bang.
We go out with a bang. It gives a wide variety of clinical problems. We do a session on genetic disorders, and I have to say that was us listening to our first group of students who really told us that they wanted a complete teaching session in pediatrics. And you know, we deemed that genetic disorders are essential. I mean, it's partly maybe my prejudice, because I have a particular interest in genetic disorders, especially tuberous sclerosis, but we were able to get a very excellent dashboard written by Professor Julian Sampson of Cardiff, who's one of the top geneticists in the UK, but a very down-to-earth fellow, and give a really good, very basic teaching program on genetic disorders. And then we brought in a little bit on diabetes. Now, again, diabetes is the sort of subject that you couldn't teach in 6 weeks. In fact, there's iheed of separate programs on how to deal with diabetes, but really diabetes as relevant to general practice, you know, how it presents, you know, or what you maybe need to do if you see a child with diabetes in out of hours or something like that. And then we go through abdominal pain, dehydration and rehydration, and diarrhea. We consider that fluid balance is an important part of your education, partly because you know, in case some of you go and do sessions in A&E, or maybe do locum sessions in the pediatric ward, and to actually, we don't feel that we can send you out without knowing the basis of fluid balance. We don't talk about how to get treatment of diabetic ketoacidosis, because that is very much a specialized field. But we do teach you about dehydration and rehydration regimes, partly because in Northern Ireland here, we've been cursed with this hyponatremia, which I'm sure a lot of you down south have come across. And it has caused almighty trouble because of, I have to say, poor prescription of fluids. And then the rest is really good common problems: headaches, cardiology, syncope, rheumatic heart disease, allergies. And then we do what I call the liquors all sorts, childhood limp, acute abdominal pain, and the testes is sort of a surgical look at these things and how to do them. And again, as you can see, there's so much in each lecture that it's hard to know what to leave out. And this is why I say that the whole teaching experience isn't very much in conjunction with using the dashboard. And also, you know, it is also with you building up your own notes throughout the 22 weeks. And certainly it's my practice to give tables to you, you know, that I get them from uptodate.com, you know, about the different causes of abdominal pain. Now, you don't expect it to know, you know, all the different causes of abdominal pain, but what I want you to do is to have a notebook to go back to, that if you have a child that's coming in with a lot of abdominal pain, you can just go and refer to the notebook and say, well, have we excluded these causes of abdominal pain, or do we need to refer the child? You know, so it's trying to build up a helpful knowledge base for you that you will have when this course is behind you.
Yeah,
okay?
Absolutely, Charlie. And I think, you know, what you've shown there is a huge breadth and kind of depth of coverage, and the way that this works. And I think Hannah was saying it at the start that, you know, she found the time commitment achievable. She found the intensity of the program achievable. So the first thing we'll do is we'll bring you in for an induction week, which, you know, online learning is new to a lot of people, and certainly returning to study is new to, well, not new to a lot of people, but it's been a while since people have done a formal qualification. So induction week is all about getting you comfortable with the program, the supports, the platform, the regulations, things like that. Then we start into each week, and each week follows a pattern. So we'll start off with a discussion forum post, and that'll be linked to a particular week's topic, and those topics are dealt with in a huge amount of depth on the online platform. And really, you know, what Hannah said and what Charlie said, you know, the quality of the learning experience online is unbelievable. So the online learning environment, the dashboard here is it's second to none. It'll present you with really strong patient cases. It's got a focus on clinical decision making. You can use it on, you know, tablet, laptop, mobile, you name it. And so for each of those weeks, you bring yourself through this online content at your own pace during the week. You contribute to a discussion forum with your peers whenever you want, and then you attend your weekly tutorial, and that is once a week for an hour. In Europe, it's on a Wednesday or a Thursday evening. So, you know, Hannah's session is on now at 7:30, and she'll spend an hour discussing, you know, they're midway through block 3. I think actually they're on dehydration and rehydration tonight. So, you know, they'll spend an hour discussing case management of that, how it presents, what they need to know, what the red flags are, and really kind of bring the content to life. So that rhythm then of, you know, the discussion forum, the online content, and the tutorial, that repeats itself each week. And what it allows you to do is to say, well, you know, like Hannah, right, I'm going to dedicate a couple of hours on a Sunday morning or a Tuesday evening, whatever it is. And you can ring fence this program and not have it seep into the rest of your working week and family time, etc. So it's definitely, you know, it is achievable. It is very achievable within your normal clinical practice, and, you know, not impacting too much on family life either. So someone's just asking in the chat there. So there's one class per week. So there's one class on either, if you're in Europe, it's a Wednesday or a Thursday evening. If you're in Asia, it's a Thursday evening in Asia, or it's a Friday morning in the Middle East. And I suppose what I'll do before I come on to assessments, I think what makes this program special is you will be in a small group. So there'll be 25 people in a group. You'll get to know your tutor really well. They will guide you through the whole program, and you from start to finish, you'll have a consistent small group that you're with. The 3 blocks are, we think we've got the timing of this pretty much perfect now. That we've got a really good balance between doing the program in the right amount of time that is quick enough that you get through it at a good pace, but not overwhelming at all. We think it's 5 to 6 hours a week maximum commitment, and so if you can put a couple of hours in on a weekend morning and then attend your weekly tutorial, that's going to be more than enough. And underpinning the program, then there's really strong support. So you've got Charlie, myself, the program management team. The tutors are absolutely fantastic, and then there's technical support and other supports there, but there's a team that are guiding you through this all the time. So assessment is something that we spoke about with Hannah. It's very straightforward. We have incredibly high pass rates, and that's not a case of the assessment being easy. It's that we have, the base requirement to come onto the program is that you're a medical doctor. So we obviously have a very high performing population to start with. The learning experience with your tutors, with the online content, is amazing, and you then have fair assessment. So we expect high pass rates. So there's a skills portfolio, that's the video that we spoke about with Hannah, where we will assess communication skills around history taking, around explaining a diagnosis or breaking bad news. And that is really simple, that you get a phone out, you record a video of yourself going through this with an actor, and then you upload that and get feedback on it. So really straightforward. The exams, then, they are multiple choice exams. So the majority of questions are either single or multiple best answers. And then there's a small amount of free text answers as well. But you can see there that the timing of the exams, they're pretty short exams. They're really there to assess clinical decision making, and can you apply the content that we're teaching you throughout the 22 weeks of the program. So in terms of eligibility, and I see a question come in there in chat. So this program is for doctors only. There probably is a market for a program in pediatrics for a wider population of nurses and allied health, but the program by the College of Physicians is only open to doctors. It's conducted through the English language. Now, we will not ask you for an English language proficiency test, but what we will ask you for during the application stage is a personal statement. And obviously that will be through English. And then our education advisors will be talking to everybody that comes onto the program. And really, all we want to make sure is that you're capable of completing a program that's conducted through English. The fee is €2,500. You pay that with a €500 deposit to book your slot on the program. I have to say, this program has been oversubscribed every single time we have ran it, and there is an additional intake this year because the demand is so high. Charlie and I and Rebecca are continually bowled over by the level of interest in this program. It's amazing. So if you are interested in booking a slot on the program, it's because we do this in groups of 25, there are limits to the number that we take each time, and so you would want to book your space as soon as you can. You then go on and you can either pay in full, you can pay 2 payments of 1,000, or you can pay in payments of €500. The price is set to be pretty accessible no matter where you are in the world. So there aren't scholarships available beyond that. In terms then of some of the metrics coming off the program, and this slide is slightly out of date. We're heading at 1,000 people now over the past year and a half. The 52 countries is probably reasonably accurate. There's 92% student engagement, and again, that speaks to a really, really good program design, that the vast majority of people are able to engage with the program right throughout their learning. There is unbelievably positive experience given back to us as feedback on the learning experience, and the pass rate, 98% of people have gotten through the program. So it is a tiny minority of people that haven't gotten through the program. So we're incredibly proud of what is, there's a high bar of entry. Everyone's a doctor, so you've a really high standard coming in. There's a really, really good education experience, and then we expect people to come out the far side intact. So to summarize, and then we'll get to questions on the coming in the chat. So it's 22 weeks, and there's study breaks built into that. So there's breaks between the blocks, there's breaks around New Year's. The program, as I said, it's open to medical doctors. You're covering off kind of what are red flags, what are common presentations, and lots of areas of pediatrics that you should have a really good kind of base knowledge in. The online education experience is phenomenal. That's we're incredibly proud of the program. We're incredibly proud of the feedback that we get from it. The award is a diploma from the College of Physicians that travels globally. It is an incredible thing to have on anybody's CV. As I said, the fee is €2,500. That is set to be hopefully accessible to the vast majority of people. And as I say, this program is oversubscribed every single time we have ran it, which is amazing. But it does mean if you want to enroll, the advice is to do so kind of sooner rather than later. So I will stop sharing there. Rebecca, is there anything on chat that I haven't covered off?
Yeah, I think Joseph's been doing a great job answering the chat all the way along, to be honest. So there's very little that remains unanswered. Dr. Sharif Arabi there is asking how many runs already finished. So how many intakes, I guess?
We're on to our 7th intake now.
7th, I believe it is, yeah.
Yeah. So actually, here's a really good question. So someone's preparing for the membership exams. Absolutely. I think a program like this is going to be, because the membership exams are, they're obviously, it's an assessment hurdle you need to get over. There'll be a huge amount of relevance. There'll be a huge amount of learning materials that would support you in your preparation for the membership exams. This is aimed at people that are both in general practice and at the start of specialist training. So I think, yeah, absolutely. Charlie, do you want to come in there?
Yes, I would qualify that, Dermot, and say membership part 1, it would be relevant for. We would give you the basic pediatric knowledge. But if the membership exams are the same format as when I was the examiner and everything, we wouldn't go into just the same detail of the complex cases that would be needed in membership part 2. And that is really, I'm basing that on my knowledge of the RCPI from London rather than the Dublin exam. So I would say part 1, it is very relevant, but really not for part 2. Not for part 2.
Yeah, I think that's fair, Charlie. Materials or books? We don't recommend books or materials because all of the content that you need to get through the program is on the platform. It's in your online content. So each week you're contributing to a discussion forum, but the majority of your time during the week is going to be spent going through that online material, and it really is phenomenally powerful. I'll screen share for a second to just show you what some of this looks like on a day-to-day basis. So I'm randomly going to go into respiratory symptoms. So each of these represents a week. then you go into the particular week, and the first thing you're going to get is the learning outcomes for the week. You've got really highly visual content, lots of multimedia.
Or in the case of otitis externa, fungal.
So I won't play too much more of that. It's very, very interactive. It, as I said, really visual. Then we'll get into, once we've given you the kind of the clinical background to everything, we then get into patient cases, and you're given lots of supplementary reading, but we'll get you into patient cases. We'll give you different case presentations. There's scenario-based games in this as well, where you work your way through a case, and it gives you the opportunity to make mistakes and learn from those mistakes. And so you don't, the concept of a book per se, we think is actually a little outdated, and this gives you a far more interactive learning environment. So the short answer, you don't need a textbook, because the platform gives you absolutely everything that you need to study from. So what else has been asked here? Yeah, you'll have access to the content for a period of time after the qualification finishes. It's usually a couple of months, but as Charlie said, the goal here is that you're building up your own reference guide as you go through the program, so that you have so that you've got a repository to go back to. Sorry, Charlie, yeah, do you want to come in?
Yeah, just check that I'm unmuted here. Yes, no, you can hear me. I just wanted to say that we do actually give you references for other websites to use. As I said, in genetics, especially, it's very relevant that you don't have all the information of genetics and rare conditions, but sometimes you do need to look up the information if you're presenting with a case of a rare syndrome. So we do give you the relevant websites that you can look up to get the information. And again, the one that I recommend to get back a lot of background information and things is uptodate.com as well. So that's the ones to use. Textbooks are out really now. They're almost out of date as soon as they're published, so
yeah, and I think the benefit of a program like this is that both the curriculum and the content, they have been developed and reviewed within the past 12 months. Dr. Sharif is asking the regular time for the tutorials. So the tutorials in Europe are on a Wednesday or a Thursday evening. There's usually 3 or 4 groups in Europe, so they start either at 7 or 7:30 in the evening Irish time. So that tends to suit most people. Again, we go with what has suited the majority. There will be tutorials that are on at kind of noon on a Thursday, which work well for people that are in Asia, and then Friday mornings for people that are in the Middle East. We occasionally have someone from the UK or Ireland says, actually, a 7:30 tutorial on a Friday morning would be perfect for me. So when you're speaking to the education advisors about coming on board, they'll be able to give you all the tutorial slots, and you can tell us which one you want to go into. Okay, great. What else has come in, Rebecca?
Could I just also say something, Dermot? Just to say that we do listen to the views of the students as well during the course, and it's your course, and we do listen to any helpful suggestions that you have about teaching or teaching subjects. So it's not just a matter of us just giving out all the stuff for you. If you have anything that you feel needs to be included or you want it better explained, we're very happy to listen to you.
Absolutely. As Charlie said, the curriculum is regularly reviewed. We get that feedback and take it seriously every time. Every time we run the program, we ask for feedback during and after the program. So it's something that's continually being updated. Okay, brilliant. Rebecca, I'm scanning through chat. I think we've hit lots. Oh, does the certificate have the Royal College stamp? It absolutely does. So what you get in terms of a certificate is a beautiful piece of parchment which has the seal of the college on it. It is signed by the president and by one of the directors of the college. It's a diploma in paediatrics. I think it is important. It doesn't mention iheed anywhere. It doesn't mention online education anywhere. It's a diploma in paediatrics from the Royal College of Physicians. And yeah, the wax seal on it is lovely.
Great. Yeah, but then we've covered the times, the tutorials and everything. So I think,
Yeah.
just for
Brilliant. So, yeah, I think, you know, the final point I would leave people on is this program does get oversubscribed every time, and you know, we're incredibly proud of it, but it will fill. So if you are interested, I would apply sooner rather than later.
Yeah, it just just because it's online, it doesn't mean that we do cap the number of places, because we pride ourselves on tutor to student good ratios. So if it goes over a particular amount, it's usually 25 to 30, we will break up the group again. So we do have very, very limited places left for this August intake. What will happen is that we will send you a recording of this event. It'll be in your inbox by tomorrow, and it'll also have an apply now and a pay deposit link on that email. And also our education advisors will be reaching out to you so they can counsel you, and if you have any other queries, they can talk to you directly about that. So I would advise, though, if you are interested, because there are only a few places left, to go ahead and apply and pay your deposit as soon as you can.
Brilliant. Thank you so much, Charlie, and to Hannah for earlier, and Rebecca. So look forward to seeing lots of you in the program, hopefully.
Thank you so much. Take care.
Bye.
Lovely to talk to you all. I hope all the very best.
Thanks, Charlie.